Welcome to This Week in Medicine. It's January 10th, 2022, and there is a lot going on, so we will try and get through this quickly. I always try to make these talks 10 to 15 minutes, and they never are that short. Courtesy of our technical advisor, i.e. my 14-year-old son. We have a nice laser pointer today. Hello. So maybe that will help you. That was from a comment from a viewer. We do take your comments seriously here at Foxhall Foundation. We have an educational mission, although this is not the picture of our current educational mission. Our educational mission right now is all virtual and will be hopefully only for a couple more weeks. Foxhall Foundation. We have held our yoga classes. We are not doing them right now. We're on Omicron pause. So hopefully that will be over soon. And hopefully some new classes this year, but let's get through this Omicron first. So in the inbox for Dr. Thomas's inbox this week, we have Omicron and treatment, basically inaccessible. We have some Paxlovid, we have some Sotrovimab, not really available to us because the doses were so low. 50,000 doses of Sotrovimab already dispersed through the country and probably already used up, gone. Paxlovid not meaningfully available in our local pharmacies. A fourth shot, we'll talk about that in a minute. That advisory was just released today. Omicron and travel tests, boy, that's a tough one too. People need to get negative tests before they travel, negative antigen tests. Those are difficult to get when you're on a tropical island. Isn't that true? Antigen test is still negative, although you know you have the virus because you have a fever and a sore throat. Trust me, if you have a fever and a sore throat right now, you have it. Omicron and elective surgery. I just finished off a couple of pre-ops today. We are going through with surgeries. We are trying to keep the system going. So if you have something planned, now's the time to do it. Omicron and masks. We talked about this last week. Your best protection right now, and probably honestly, our best protection if masks had not been so politicized would have been to wear an N95 mask or a KN95 mask since March of 2020. Which is what your doctor has been doing, and most doctors have been doing. Omicron and school, this is a dicey issue right now. Chicago is still out of school. Locally, I was so thankful that today there was supposed to be a distribution of KN95 masks at school. They didn't come in yet, but the intention is for all the kids to get a KN95 mask. So let's not talk about Omicron for a minute. This Lipoprotein A article came to me from some patients, courtesy of L&T. Thank you, L&T, who sent me an email talking about lipoprotein a type of bad cholesterol you've probably never heard of. Well, if you're my patient, you probably have heard of it because I do try to screen everybody who might be at risk of this. How do we know if you were at risk? We look at your genetics. So the key points from this article in the Washington Post, which came out January 7th, I believe. It's also an 8-minute audio that you can listen to. Consider the source of this article. Every time you read an article, consider the source. This is an MD, PhD who wrote the article, working in New York, very reputable source. I thought this was a great article. I've read many articles on lipoprotein A, and this is probably one of the best and most accurate I have read. Lipoprotein A is a kind of cholesterol particle. It's sticky. They describe this as sticky many times in the article. I think that's actually a good analogy. It's a stickier type of cholesterol particle, so it sticks to your arterial wall better. We don't want that. We don't want plaque sticking to our arterial walls. Remember, we don't treat blood tests. Dr. Yamamoto is famous for saying this. We prevent plaque. We treat patients. We're not treating your numbers. Numbers lead us to assess for risk. So that's what we are doing with the lipoprotein A. It may be in as much as 20% of the population. This article also discusses this is not a universal screening test, although some people think it should be. We can use refined screening criteria to decide who should get this test. If you're talking to me, if you have a family history of early or aggressive heart disease, stroke, vascular disease, if someone in your family already has lipoprotein A identified, then we should screen you for it. We don't treat the lipoprotein A number itself. Again, we're not treating blood tests. We're treating to prevent disease. So we measure the lipoprotein A blood test, but we use it as a screening test for early and aggressive plaque growth. We're all going to make plaque. We've talked about that with you before. We can prevent plaque because we have great drugs to do it. But do we need to know if you're a part of a riskier population for early and aggressive plaque growth? Yes, we do. So what do we do with this blood test number? We screen you to see if you do have plaque already. And we do that with the high resolution carotid ultrasound in our office. And a lot of other doctors do that too. It lets us know, are you building plaque already in your 40s or 50s? If you have lipoprotein A, you might be. If there's a family history of lipoprotein A, you might be. If you have a parent who had to get the plaque scooped out of their carotid artery at 60 years old, you probably should see if you have lipoprotein A. So in our office, an easy 10-minute high-resolution carotid ultrasound. Then we use the national guidelines to decrease your LDL cholesterol and follow how much plaque you have in your arteries. Hopefully it won't be any. The coronary calcium scan I don't like to use because it causes you to have radiation exposure and it shows calcified plaque. By the time you have calcium in your plaque, it's not early plaque anymore. Is it too late? It's never too late to look for plaque. But the high-resolution carotid ultrasound will show us an earlier biologic lesion of plaque. Remember, this is from one of our old talks. This is the rust. This is the plaque accumulating in your pipes. You don't want to be dirty on the inside of your arteries. And this is the simple test. It's our technician with an ultrasound on the neck. She's excellent, so it takes her about 10 minutes. It's certainly painless. It's quick and easy. We see through the wall of the artery. This is the muscular wall. This is the blood flow. And it tells us, is there plaque there? So it tells us, should we be giving you medication to prevent more plaque from growing? Easy test. All right, so we're going to have to get to it at one time or another, so we might as well just get to it. Are we peaking for Omicron? We probably are. I've watched the hospital system, one of the regional hospital systems in our area. I can look at hospital admissions, and it looks like hospital admissions for a major regional system are plateauing for admissions with Omicron. I watch this every day. We can't account for home testing. There are a lot of people who are testing at home who are positive and staying home and quarantining. Trust me, I get phone calls and emails every day. So those people are not included. But because hospitalization puts such a stress on the medical system, it is an important number to keep in mind. And also looking at our ICU admissions, which are still full of the unvaccinated. We have a highly vaccinated population here, lots of vaccination, but also a high incidence of Omicron. So again, the symptoms of Omicron we talked last week, sore throat, or some people say scratchy throat. It's mostly a bronchitis, not a pneumonia. We don't think this virus has as much capability to get into the actual lung tissue. Bronchial tissue or tubes are that tube that lead from your windpipe and branch off as the branches of a tree. At the end of the tree are the leaves. The leaves are the lung tissue. That's where the oxygen exchange occurs. Bronchitis feels bad though. You have mucus in your bronchial tubes and you're coughing. So it certainly doesn't feel good, but it doesn't carry the dire consequences of a viral pneumonia. Night sweats is big. Fever, body aches. No big reports again of anosmia, which is lack of smell. There are gastrointestinal complaints, and I am hearing reports of diarrheal illness, usually very early on or 5 to 10 days later. And we have not seen many blood test abnormalities, and that's just on people who went to the emergency room who were able to get evaluated. So I have a case report from a patient this week who sent me an email from the Wild West of Medicine, otherwise known as Sarasota, Florida, where today it was reported that Evusheld, which is a medication that's supposed to be used to boost the immunity of people who are immunosuppressed in the state of Florida, all inexplicably got sent to one particular clinic, like a majority of the supply in the state of Florida. No one knows how that happened. Interesting things happen in Florida. So this was my first patient in 5 or 6 weeks who I actually sent to the emergency room. I haven't sent anyone else to the emergency room, and I'm sure I've had hundreds of patients report Omicron infection. The reason I sent Jay to the emergency room is she has a history of chronic lung disease. She's had chronic bronchitis. She's over 65. She's incredibly super healthy and active, very spunky, but she was checking her pulse ox at home. I think you all know what the little pulse ox device is. It's about a 1-inch size rectangle. You put your finger in it and measures your oxygen level, sometimes not reliably. Hers was under 90, so for me that was the trigger to get this pulse ox number confirmed and make sure that she did not need to be admitted to the hospital. So I did send her to the emergency room where she was able to get pulse oxed in the waiting room, and it was well above 94% every time she did it. But unfortunately, that hospital in Sarasota is full. I think there was a 4-hour wait at least, and she still had not seen a physician. Was her pulse ox faulty at home? It could have been, but these are all kind of tricky medical devices. They're not always super accurate. So she was sent home. I think she's doing fine. Jay, if you want to send me another update email, you certainly can. But thankfully, she did not get admitted. So at least for my large patient population, I have a large patient population. So far, this is looking not so bad. Certainly not as bad as March 2020 and not as bad as Delta infection. Again, just bringing back the same slides on the mask study. Get your mask game upgraded. Excellent study verifies that if you're wearing an N95 mask and you're with somebody with an N95 mask, your rate of transmission, 0.14%. So very low risk. This is a great study. So test kits, testing in the DMV. In the district, you can go to the district website. I've been looking at this district website since March of 2020. It has been excellent. DC Health, it lists the times when these test kits, antigen test kits are available, the site, which are generally the libraries, and the address. So go to your DC Public Health Department website. It's an excellent website. It always has the red bar across the top, and it will give you locations where you can pick up tests. In Montgomery County, again, rapid test kits at the libraries. Get rapid test kits at any one of the 19 Montgomery County Public Library branches starting Monday, January 10th, 2022. So DC was way ahead of the rollout on the test kits. So go again to the Montgomery County government website and you can see where you can get your test kits. Virginia, a little bit slower. When I looked, they said as of January 7th, they had no test kits. But again, if you're in Fairfax County, check out the website. They're starting to roll out some test kits at these locations. So Omicron testing, remember these were some of the test kits that I showed you before. There's another one that's in a red box that I had with me to show you, but I don't have right in front of me. These are rapid antigen tests or PCR tests. If your rapid antigen test is negative and you can get access to a PCR test, that might be positive because it's a much more sensitive test. Nonetheless, right now, if you have a fever, a sore throat, and chills or body aches, or coughing, you probably have Omicron. It's everywhere. So why do the testing? Well, you want to test to be sure for your kids going to school. You want to be sure for your 90-year-old mother or father. But basically, if you can't get the test, assume you have Omicron. But hopefully testing will be rolling out soon so you can be a little bit more sure. Remember, PCR tests are very sensitive. So they can be positive as long as 38 days, maybe longer, because they are picking up dead particles, you could call it, of virus that are still in your nasopharynx. So they're picking up little pieces. You may still be positive. So once you've done a PCR test and you know you're positive, you don't keep doing PCR tests. If you want to confirm that you've cleared the virus, you can use the antigen test to get yourself out of quarantine. Again, this was really designed to get essential workers, essential healthcare workers, back into the hospital and working, or back to their essential job if it wasn't a hospital and working. So it was meant to be used on day 5 through 10. We really do recommend 2 negative antigen tests. So you do one, the next day you confirm it's negative, do another one. If you have 2 negative antigen tests, you could safely leave your quarantine at home, but continue to wear an N95 mask until day 10. This is to get you out of quarantine early. If you're not an essential worker and you're staying at home anyway, you need a full 10-day quarantine. This was just a way to mobilize essential workers because right now there are too many medical workers who are out because they have Omicron. The federal test kits are supposed to be coming. There's a government website. I didn't actually get to check this today, but as of yesterday, the government website wasn't announced yet. Maybe it has been. So you will go to a government website. You will order your test kits to be delivered at home by the Postal Service. No mention of vendors, but I think probably some of those pictures we saw on the previous slide will be the vendors who are used, who will provide these test kits. It's supposedly a free test, but these are our tax dollars at work. So it's a $1 trillion program that will be paid for by our tax dollars so that we can receive free antigen test kits at home. This is going to be 500 million test kits that are sent out. This article, if you want to read it, was in Health. It was January 7th, and it answered a lot of questions about these test kits. So it's a nice article from Health Magazine, January 7th, what you need to know about these free test kits. Remember Omicron in social groups? If you are in a social group right now and you're without masks, you have a high likelihood of getting Omicron. Omicron therapeutics, remember Regeneron doesn't work. There are still some people, I think, being offered Regeneron. It's largely been halted because CDC says maybe 90% now of our infections are Omicron. Sotrovimab from GlaxoSmithKline does work, but I don't know that there are any sotrovimab doses left. In Maryland, supposedly they were given to the nursing homes. Even our largest hospital system in the state of Maryland did not get sotrovimab to distribute. Evusheld, again, they're using it in Florida, but I didn't think it was FDA approved for treatment. It's approved to use as prophylaxis, meaning that you give it to people who had no antibody response to their vaccination. It's effective, but it's really supposed to be used to immunize people in a sense. Omicron's predominant, so we can definitely switch treatment if we need to. We're not testing for individuals, so we can't tell you if you have Delta, Omicron, or any other version of this virus. But at this point, assume it's Omicron. Paxlovid's approved, but I don't know any pharmacies, at least that I have access to, where it is currently. It's in Baltimore City and other parts of the state of Maryland, but not anywhere, I believe, in Montgomery County. So a fourth shot. Generally, no. A fourth shot is not a booster. This was really meant for people who never responded to 3 mRNA vaccines. Why would they not respond? I have a very small group of patients who've had organ transplants who are immunosuppressed, who have lymphoma or on chemotherapy. We check their blood tests and they never had an antibody response. If you have never had any demonstrable antibodies, and it really is only going to be likely this group of people, then you're not getting a booster shot because there's nothing to boost. You never had an immune response to begin with. So we're not talking about a booster. This is an attempt to get people some immunity from vaccination who basically had none. So if you were getting active cancer treatment, especially a lymphoma or CLL, that could be you. You might not have responded to any of the mRNA vaccines. Had an organ transplant, so you're on strong immunosuppressive medication, stem cell transplant, advanced HIV infection. I don't have anyone in my clinic, I do not think, with DeGeorge or Wiskott-Aldrich syndrome. That's severe immune deficiency. Or if you're on high-dose steroids, which would typically be 40 to 60 milligrams, or strong drugs that suppress your immune system. So this is not a recommendation for probably at least 90% of my patients. It is not. This is for a select small few people. And I kind of wonder if this really makes sense, because if you didn't respond to the first 3 shots, are you going to respond to a fourth? Or should we try to get you Evusheld? It would be nice to be able to give you Evusheld, and I will check with my colleagues in infectious disease to see if we can do this for this select group of patients. I've been trying to stay on top of this, but when the virus changed to Omicron from Delta, we didn't have the advantage of as many tools in the toolbox, and our Regeneron trials and other trials to try and give immunity to people who never had it from a shot was lost. So all we have is Evusheld, and I don't know of anybody who's gotten it yet. If you did get it, or if you had access to it, certainly let me know. I would love to have that information. So did this extremely mild Omicron variant? I think if you had it, you wouldn't say it was extremely mild. I've been talking to people for 6 weeks now, and it's not extremely mild. They're not hospitalized, but they don't feel good either. Has it killed off Delta? It looks like it's killed off Delta. Let's hope Delta doesn't come back. Again, wear your mask. If you have a hard time finding a reputable mask, the New York Times has reviewed reputable masks. You want to look for the NIOSH, the NIOSH on the mask. There are lots of ways to get reputable masks. Yes, there are counterfeits, but yes, there are also ways to get some reputable KN95 and N95 masks. Tony's tip of the week: wear a mask if you're coming into the office. Not a cloth mask, not a surgical mask. We are doing our best, but it's hard to screen everybody. We do temperatures, But again, remember, a day or two before you're sick, you could be contagious. We do not have antigen testing in the office, but again, I showed you a slide where you can pick it up at the library. And we don't have real-time PCR testing because our lab is a Quest lab and they cannot turn them around that fast. Fourth shots of COVID vaccine have no CDC or FDA approval except for the moderately to severely immunocompromised. And that's really a very small number of people. You can go back to that slide and see if you qualify. And again, I really question whether or not doing a fourth shot is really going to give you immunity, or if we have better data with Evusheld, which I think we do. Hospitals locally do not have capacity for testing for asymptomatic or doing antigen testing. So we cannot use our local hospitals for that. Fast pitch, Omicron is here. Don't go to a maskless event unless you don't mind getting Omicron. Revisit your mask habits indoors and upgrade your mask. It's not too late to get your flu shot. Flu season usually starts around this time into February in our area. Do you need a Lipo A test? It's just a blood test. That's an easy discussion to have with your doctor. Vaccination does not prevent Omicron transmission. This is something that Rochelle talked about today. Dr. Walensky, she mentioned in an interview, probably with CNN. This is somewhat of an obvious finding. We know it doesn't prevent transmission, but just to be very clear, vaccination prevents hospitalization and ICU admission. We're not preventing transmission. The way to prevent transmission is to wear a high quality mask, which is the way we should have been preventing transmission all the way back to March of 2020. There's no fourth shot yet, unless you're in that very small category of people who are severely immunosuppressed. Remember working on your health pyramid. Thank you for your attention, and I'm sorry that I was not able to squeeze this down into 10 minutes this week.